to avoid having that secondhand exposure to the children. So it's this slide. As this has been set up, it goes into effect January 1st, and then there's a 6-month education phase before we do any enforcement. And this is pretty traditional as far as trying to make sure that we have time to get the word out to affected businesses and help them understand what the new rules are, and also try to provide them with technical assistance with signage, education materials, answer questions, help them with trying to figure out if there's anything they need to do or if they're already in compliance, have those conversations, and then no enforcement to begin until that 6 months is over in January 1st of 2021. As I was saying, an example of how this might look would be we had a smoking complaint in January of 2020 where we had a business with employees who were basically smoking at the back door. Because that was convenient for them, it was covered, but that violated the conditions of the smoking in public places where you're supposed to have 25 feet between where smoking happens and the building, so you don't have that smoke coming into the building. Our employee went out, verified that that's what's going on, worked with the owner and management to understand what needed to happen, which is basically that they needed to move that smoking area at least 25 feet away from the back of the building and that doorway. So they worked with the business owner to identify and locate a spot that might work better for that. Basically put a sign, put a little, cigarette butts container out there, and then they worked with their staff to help them understand that they had to smoke further away from that door, and provided them with signage. And then we haven't had a complaint about that facility since then. So that's pretty classic for the process of identifying a problem, educating, trying to provide technical assistance, and generally that's been very effective for these smoking types of complaints. We've had, just for comparison, we've had 23 of these in the last 10 years, and only 5 smoking complaints in the last 5 years. So definitely most businesses have understood what they need to do as far as where smoking can or cannot happen. And it's been, I think, very effective for public health to use these as tools. And we've seen very little either complications or impact from the existence of it. And we've not had to move forward with any kind of fees or whatnot, or any kind of violation processes beyond that education point, easily within the last 10 years. So hopefully this will, again, add that vaping component to the existing smoking in public places law, and hopefully should not be, again, too much of an impact on surrounding businesses as we move forward.
Okay, questions for Shelley or Kateri or Sammy?
Actually, I don't have any. I think we've been briefed on this quite a bit during the past year, and I think staff has done an excellent job on explaining it.
I do have a question, and this is for public consumption, because we have been briefed on it. The ordinance actually says that we're adopting a fee for administrative review of applications. Well, how much is the fee? Is it something that's being added?
So I can speak to that. Basically, there's an application to seek a rebuttal, and that's their language. But basically, if you want to be able to have smoking occur within 25 feet of a window or a door, there's an ability for you to have that reviewed. For instance, and this has been years ago, the Falls Terrace restaurant has a small smoking deck that's on the backside of their building, and they wanted the ability to have people out there smoke within that 25 feet. So they applied They paid an administrative fee. In this case, it's $300 and I believe it's $390, which basically is an hour and a half time for us to review the fee. And basically, it's similar to a variance process. But basically, it's their opportunity to say, we can still meet the needs of keeping smoke from entering the building by doing something else besides that 25 feet. In their case, they worked with a HVAC contractor to change the ventilation system of their restaurant so that whenever the door opened, air from inside pushed out. And so that kept the smoke from that deck from coming back in. And then we approved that. But that's really the only fee and application processes built into this, is if a business wants to seek that rebuttal and seek a variance from that 25-foot distance because they've done something else with their ventilation to make that still an effective barrier.
Oh, thank you for that. And if this is approved, it takes effect January 1, 2021, and after 6 months of education, what's the consequence for a violation?
So even after January or July, after that 6 month period, if we receive a complaint, the same steps that we would follow would entail validating the complaint. So having staff go out, looking at the situation, trying to understand what's going on, working with the owner manager around, making sure that they're educated about, here's what the rules say, here's what you need to do, or here's some ways in which you can accomplish that. And then working with them to attempt to figure out what they need to do, either staff training about, hey, don't smoke right by the back door, or, create a smoking area, or put some signage up, whatever that need is, working with them to try to provide that technical assistance. And then we give them some time to implement that. If we come up with a second complaint about that same situation, and we've already provided all that kind of assistance and education, then we would look at a notice of violation, so written documentation of the problem, timeframes to correct, as well as what things they need to correct, and then give them again that time frame to make those changes. And if that failed, or if we received a third complaint, then we might looking at a civil penalty, some sort of fee, basically, which is set in the ordinance. But again, we've had a similar structure set up for the smoking in public places law, and within the last 10 plus years, we've had none of those complaints move forward into actual enforcement, because we have been able to work with those businesses to get to compliance, mainly just through education. And this is one of the things that makes this easy, is that there's broad public support for this activity to protect both employees as well as the public from smoking and secondhand smoke. And so, anyway, yeah.
So but it stays in the administrative or civil world. It doesn't become a criminal offense.
That's correct. There's either civil penalties or civil infractions that are associated with it.
Okay.
Yes.
That's what I want the public to hear. Thank you, Sammy.
Sure.
Shelley, I wanted to ask you about your...
Jane.
Okay, Jane, go ahead.
Yeah, Commissioners, I guess I'd like to clarify some of that. So the way this ordinance is drafted, let me go back. Let me introduce myself.
Yeah,
I
please,
forgot to do that. I'm Jane Futterman, Deputy Prosecuting Attorney, and I've been working with staff. I advise environmental health on this. So under current law, the smoking enforcement has all been under the state law. We don't have any current local ordinance on smoking or vaping, and that's what this ordinance is intended to do, is adopt some local regulations. So currently, and over the past 10 years, since the statewide smoking ban went into effect, environmental health has been enforcing the state law, and under the state statute, the health department may issue fines to businesses and individuals who are violating the law. And there are basically two enforcement mechanisms. Well, actually, there are two enforcement mechanisms. Law enforcement can find an individual who is smoking by issuing a civil infraction, but that's a law enforcement provision, and generally that has not been implemented by most law enforcement jurisdictions. And then the local health jurisdiction, working with the jurisdiction's attorney, can seek an injunction in Superior Court. By adopting these new regulation into the Sanitary Code, it really just puts the smoking and vaping ordinance within the scheme that's already set up in the Sanitary Code. And so there are a number of different enforcement mechanisms that already exist in the Sanitary Code, apply equally to swimming pools and septic systems and food service violations and all the realm of things that are in the Sanitary Code. So the penalty provisions always start with a notice of violation. It's required to put in writing a statement to the person who the department has found in violation, notifying them of the violation and giving them a reasonable time to get into compliance. And I know from working with the department over many years, they really do try to work with individuals to get them into compliance. If that is not successful in terms of issuing a notice of violation and working with them, the various enforcement mechanisms include civil infractions, which are a monetary penalty that's handled through district court, or administrative civil penalties, which can be issued by the health department. But there are provisions in here also where, depending on the nature of the circumstances, the department may refer the case to the prosecuting attorney's office, either to seek an injunction, which would be a court order ordering generally would be a business or property owner to bring their property into compliance. So it would be, getting compliance with the smoking and vaping regulations. So there's the potential to go to court and get a court injunction. And then there is also a misdemeanor provision in the code that would allow enforcement by misdemeanor for violations of the Sanitary Code. I can tell you that I don't believe for all the kinds of violations in the that could happen in the Sanitary Code, there may be over the last couple decades that's been used once or twice. It's very rare that anything like this would rise to the level of any kind of criminal violation.
Thank you.
So those are, so basically there are a variety of kinds of enforcement, and the department tries to start at the lowest level.
All right.
Thank you. My question was for Shelley. You mentioned the one written comment was in strong support. Did the person indicate on what basis they supported it? Was it about curbing youth vaping? Was it about the annoyance when they go to a restaurant? Did they say why?
Yes, sir. So Ms. Gutman said in part, and you will receive a copy, you should have a copy of these comments for the official record. I won't read the whole letter, but an excerpt to address your question. This is in the words of Ms. Gutman, I'm especially eager to support as much restriction as is possible on the use of these products, vaping, in outdoor spaces where other citizens are engaging in recreational activities such as parks, jogging, walking trails, bike trails. Being outdoors does not prevent others from being exposed to secondhand smoke or vaping. I frequently walk and jog around the community, including around the popular Capitol Lake Trail, and I'm frustrated to be subject to inhaling the toxins of smokers and vape users who don't seem to understand that their products are going directly into my lungs. Thank you for sharing my interest in our BOCC supporting the health of Thurston County citizens through regulations for these harmful products.
Thank you. Anything else?
Oh, sir.
No, sir.
Okay.
Nope.
Then I appreciate that presentation, and we're at the point where if there is public testimony, we'd like to hear it. There is no one present in the boardroom. I don't see anyone on Zoom that would isn't an identified member of our staff.
Nobody has registered.
And then county manager will check phone, and we may be done.
Good afternoon. For those who have joined us via conference call who would like to provide public testimony related to this proposal, please unmute yourself, state your name, where you live in the county. You have 3 minutes. Once again, if you're joining us via conference call and you would like to provide public testimony related to this proposal in front of the Board of Health, please unmute yourself, state your name, where you live in the county, and you have 3 minutes.
Okay, we do not have any public testimony. At this point, before we have a motion to close the public hearing, there's an opportunity for the board to have a discussion about where we want to go, I guess, or any debate we'd like to have about this proposal.
The only discussion I have, or comment I have about that, is I'm in full support of it.
Could you actually take an action to close the public hearing, please?
We
We were discussing it.
You need a motion to close the public hearing first.
Okay. Mr. Chair, I move to close the public hearing.
Second?
Any discussion? All in favor, say aye.
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 Aye. Public hearing closed. Okay, so do we have a motion then at this point? What do we want to pursue?
Mr. Chair, I move to approve the ordinance H-08-2020, adopting a new article to the Thurston County Sanitary Code prohibiting smoking and vaping in indoor public places, places of employment, and certain youth-oriented public places.
Second?
Moved and seconded. Any discussion on this?
No, sir.
No, sir.
I just, I guess I would comment that the statistics that have been presented by our health officers about youth vaping and the rise in this product gives me great concern. I am always mindful of people's civil liberty and right to act in the way they feel is appropriate, as long as they're not harming others. I feel that this ordinance is appropriately tailored to manage that. We have, and I don't have any concern about vaping and smoking being handled in a similar manner by our county code. So with that, all in favor, say aye.
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 Aye. Motion passes, ordinance passes. We're done. Thank you so much.
Good job, Commissioners.
I know the folks on the line have worked very hard on this. Chris Hawkins, thumbs up, thank you. Terry Wimsett, you've been with us every step of the way. Sammy, thank you so much. Jane, appreciate your input and the revisions that you made to this along the way, because there were a couple different rounds of changes. Didn't the law change at some point in the middle of this? There was a provision of state law that actually modified our approach. So thank you for that flexibility, and I think we're done.
You'll have a positive impact on our youth.
Thank you, Shelley.
I hope.
Thank you.
Any last words from staff before we adjourn? Okay, thank you very much.
Thank you all. Good job.